1 in every 25 children die before their 5th birthday in South Africa. These are the latest statistics from the 2024 South African Child Gauge report by the UCT Children's Institute. The report is published annually to monitor progress towards realizing children's rights. Now, the publication focuses attention on early childhood development, reflecting on progress made since the adoption of the National Integrated Early Childhood Development Policy. That was back in 2015, and also setting an agenda for 2030. But let's unpack some of the key findings on this report. For that, we're joined by co-author and co-editor of the Child Gauge 2024. She's also a communication and education specialist at the Children's Institute at UCT, Laurie Lake. Laurie, good morning to you. Thank you so much for joining us. Such an important discussion, and I think an important study as well. But the findings, I mean, to say they're shocking and sad I think is an understatement. I want to start with that first one that I read there. 1 in every 25 children dies before their 5th birthday. That's a lot of children that we're losing at such a young age. Why do those numbers look like that?
So I think our main concern in relation to child mortality is that we appear to be seeing an increase in under 5 mortality. Over the past, say, 10 years or 15 years, we've seen steady improvements, and now in the period following the COVID-19 pandemic, we're starting to see a rise in child mortality. At the same time, we're seeing increases in child poverty and malnutrition. So in many ways, this report is a wake-up call. Our young children are in crisis. We're deeply concerned that the situation is now getting worse. And at the same time as we're seeing a rise in poverty, we're also seeing government introducing austerity cuts to critical services, and that impacts on children's access to healthcare, to early learning programs, and to the child support grant. So a time where all of us, not simply government, need to be putting young children at the heart of what we do.
Yeah, let's look at some of your findings, because it doesn't get any better as we look at the list of those key findings, right? 71% of children live below the upper bound poverty line in households that do not have sufficient income to meet their basic needs. 71%. So let's talk about the numbers, right, and the amounts that these 71% of children, I suppose, are being fed with. What are those numbers, the amounts coming into those households looking like?
So we're looking at children living in households with a per capita monthly income of less than 1,147 Rand a month. And that may be just enough to meet children's basic needs. So if you're falling below that upper bound poverty line, then as a family, you are really struggling to put food on the table and to cover costs such as electricity, transport, clothing, rent, fuel for cooking. So deeply worrying to see how wide and broad child poverty is. Sure. Because that really curtails children's development in a whole series of different ways. Yeah. We also know that 4 in every 10 children are living below the food poverty line, and that's in households that do not have sufficient income to meet the dietary needs, the nutritional needs of their child. And that's one of the reasons why stunting in South Africa has remained so persistently high. So when we talk about a child being stunted, that's a sign of chronic malnutrition. And it means not only that they're short for age, so it's had an impact on their physical growth, but it also impacts on the developing brain. Yeah. In ways that impact their ability to learn and their progress through school, and then it has a ripple effect in terms of employment and the well-being of the next generation of children. Yeah. So one of the key messages sort of coming out of the Child Gauge is this call to invest really early in the lives of young children if we're going to improve national development.
Yeah, and I want to get into what the calls are. but 4 out of 10 living below the food poverty line. That's frightening. And then you've talked about stunting. 1 in every 4 children under 5 are stunted. And if you will, just unpack in as layman terms as we possibly can, right? What, you know, I try to explain, for instance, to people in my own personal life what it means for a child to be stunted. So obviously they haven't developed, they haven't gotten the nutrition that's necessary for them to be developed. But that means that physically they don't grow even to the size that they're supposed to, right?
Yes, absolutely. I think that the other thing that perhaps we haven't mentioned in the headline findings is that we've also seen a dramatic rise in overweight and obesity in children under 5. So we're now looking at nearly 1 in 4 children, young children who are overweight and obese. And it sounds a little bit like a contradiction in terms, but really what we're seeing is families trapped by poverty on the one hand and living in communities where healthy foods are simply unaffordable or unavailable.
Yeah.
Instead, they're flooded with unhealthy foods, high in fat and sugar and salt, low in nutrients. I'm sure you're familiar with those wonderful orange chips that are filled mostly with air. So real concern about what children are eating, a real concern about food security, and then what that means for children's long-term development.
Yeah.
The 2020 child gauge spoke about the slow violence of malnutrition and how both undernutrition and overnutrition are eating away at children's potential in ways that are often invisible until the damage is really set quite deep. And we know that impacts on their capacity to learn on the one hand, but it also increases their risk of developing non-communicable diseases later in life.
Sure.
And those two are starting to really stretch the capacity of our healthcare system.
Yeah, it speaks, I mean, and this is the thing, we speak about the capacity of our healthcare system currently. What happens 20 years from now when these children, when 71% of them are living below the upper bound poverty line? What happens years from now when all these health implications, you know, come into sharp focus and they need medical attention? Who's dropping the ball, Laurie? So if we look at the various government departments, my first brain says, all right, so is it the Department of Social Development? I mean, recently the MEC for Social Development in the Eastern Cape put together, I think it was 15 million rand or 13 million rand, I think it was, to invest in child rearing and assisting families in healthy child rearing. Is that the right approach?
I think it requires a whole of society approach, a whole of government approach. If you look at the National Integrated ECD Policy of 2015, it outlined a comprehensive package of services and support for both pregnant women, young children, and their families.
Yeah.
And that should be in place by 2030. So one of the things the Gauge report comments on is the gaps in service delivery of failure to implement this very bold vision for our youngest children. And then it's important to recognize that the care and well-being and the development of young children rests on the collective efforts of many different departments. The Department of Health in particular plays a critical role because early childhood development actually begins from conception. So the care and nutrition and mental health of pregnant women is a really important foundation. And then we need to continue that support all the way through to when children start formal schooling.
Yeah.
So we have now recently, since 2022, the Department of Basic Education has taken on the lead responsibility for this broad suite of early childhood development services. We're really hoping that they're going to lead from the front, that they're going to mobilize the rest of society to strengthen investment in these earliest years of children's lives. Because we don't get that foundation right, as you can see, we are in serious trouble as a nation.
Yeah, and just quickly in 30 seconds, where you're taking this child gauge, so who you want to be engaging with it, and whose doorstep will you be taking it to?
We'll certainly be taking it to the parliamentary portfolio committees. It needs very strong political leadership. We'll be sharing the findings with the National Planning Commission, and then hopefully taking it out into communities, and equally important to business, who have a critical role to play in strengthening investment in the earliest years.
Yeah, thank you so much for bringing us those insights, concerning obviously, and reminding us just how much work really needs to be done by all of us, and certainly by the 7th administration. Laurie Lake, co-author of the Child Gauge from UCT's Child Institute, talking to us about how 4 out of 10 children in South Africa are living below the food poverty line, and 1 in 25 die before the age of 5 years old. Shocking. Lots of work to be done.